When I first started out in the schools and I started working with students with articulation goals on their IEPs, they would come into my room, and when I first was getting to know them, I would always start by asking, what are you working on, or what have you been working on in speech? And most of the time they would say, I don't know. If any of them knew that they were working on speech sounds or that they were working on a specific sound, then I might ask them something like, well, tell me, what have you learned or what have you done so far that helps you be able to make those sounds? And then they would often say, I don't know. And I just found it really bizarre that so many of them were coming to me not being able to articulate in any way, even at their own level, using their own words, any kind of strategy or something that they were thinking through or using to help them be able to produce those sounds. And I love this comic that says, what are you doing in town? And he says, you said to take the trash out, but you didn't say how far out. And I feel like that's how many of my students were coming to me, that they were being told, yes, you're coming here for a reason, but they weren't being told exactly how to make changes and how to make progress. And I say that partly because I watched a lot of SLPs giving feedback to students, and this is just through observations or different times that I, had an opportunity to observe an SLP. A lot of times I would hear them repeating, maybe, modeling those sounds, trying to, make the sound longer or louder or highlighting it in some way, but oftentimes not giving very specific feedback about what was happening in the mouth or what needed to change for that student to be successful. So they would say, copy me or do this. And sometimes that works. But when it doesn't work, I sometimes didn't see them going further and providing any explicit instruction on what needed to be happening in the mouth for that sound to be produced correctly. When I began thinking about strategies, I also felt that I needed more than just elicitation techniques and more than just sound stimulability. I felt like I could do a pretty good job of eliciting sounds, but I wanted the children to take ownership. I wanted strategies involving placement, airflow, voicing cues, using terminology that was easy for the children to understand, to remember, and to use as they learned their target sounds and then monitored their own performance. So the strategies that I began to use would highlight main production sequences. They're not all inclusive by any means, but it would just give them a framework for thinking about that sound. It was also great for coaching caregivers and teachers. For example, when I would have parent-teacher conferences, I would bring the visual for the strategy that I was using. And it was a bridge between our jargon and teachers, caregivers, and children to really make the process of articulation more concrete and accessible. I'll start by having the child picture a word with their sound. And if they can tell me what that word is, I may have them do that a few times just to make sure that they are going through that process and that the word that they are picturing does match the target sound. But then from then on, I just really trust them that they are visualizing something. And then for S, I say teeth together, tongue behind teeth, let air out slowly. So when I'm teaching it, I'll talk about how the teeth are together, the upper lower teeth touching the sides of the tongue, not letting the air escape. I'll talk about the tongue not pushing against the teeth, and then the airflow just being directed towards the little bump behind their upper teeth with their voice box off. So I'll talk about all of the details, but when it comes to the strategy, just what they are required to remember is teeth together, tongue behind teeth, air out slowly. And we go through this process, and what's really nice is when I'm giving them these incremental steps, if they don't articulate their speech sound correctly, I might say something like, which part did you forget? Or where do you think you left something out? Or, it just allows them to really begin to judge what happened and what can they do differently. So maybe they put their teeth together, they kept their tongue behind their teeth, but the airflow just wasn't there, or wasn't being directed down the middle of their mouth. So it just really assists them or enables them to very consciously evaluate what's happening and where did I break down.